Hey, everybody. Welcome to the Mind Body Connection. I'm Dr. Kelly. Today on the show, we have an amazing guest that I am so excited to host. We've been cooking this up for some time together. And today we have the opportunity to take a deep dive into Ashley Waguespack's practice and her new book. Ashley is an OT and a feeding specialist. And Ashley and I have already been picking each other's brains on the topic of airway, on feeding solutions. Ashley has a podcast, Feeding Solutions, that she invited me on a few months ago, and that was incredibly fun. And we decided to flip roles and have Ashley on my podcast. So I hope you all enjoyed the show. Ashley, let's start out with a little bit more information about you. You've been in practice for over 20 years. You've been doing this feeding thing as an OT specialist for a long time. You have lots of motherly insights. I want you to talk about your kids because you are, by practical nature and by professional specialist, bringing it all together. And your business, Sensory Solutions, has been around for some time too. So you have a lot to give, I feel like, through this little podcast. I definitely want to start talking about your book too, but in a few words, tell us like why you feel your work is so important right now.
Thank you so much again for having me on. This is such an honor. I've been an OT for over 20 years and I'm a mom of five. My husband and I have children from 20 down to six. As a therapist, you can't take your therapy hat off and not look at your children through the lenses of your job as an occupational therapist or physical therapist. As far as specifically the rabbit hole of feeding, I've always supported children with feeding. It was more regarding children with sensory processing, children with autism spectrum disorder. I'm also certified in sensory integration, so that was like the heavy part of the beginning of my practice. And over the past 10 years or so, it's been more of like a deep dive into infant feeding and more of the airway space. And I feel like that's such a hot topic. But my children, 3 of my 5, have had infant feeding difficulties. My oldest had a frenectomy at 12. And I joke with my friend who's an IBCLC. I'm like, why didn't we identify this tongue tie? And she was like, Ashley, it just didn't catch up with us. Like 20 years ago, that's not the work we were really educated on. My last 2 children were more fortunate to have had that information trickle down. And so again, because I had a child who had infant feeding difficulties, but I wasn't aware of why the feedings were endless and why there was pain and why he was miserable, it helped me to act a little bit sooner with my last 2 children. And then just the compassion of living it as a mom and seeing moms come into my office and struggle with the things that I've been through, it becomes your mission. I was able to take my feeding background with older kids and just slip right into more of the support from, as a lactation counselor and occupational therapist, meet the needs of from a very young age. And it's been so empowering to educate moms and enlighten them. Like we're supporting your baby now, but we're also going to support them to be the healthiest version of themselves. We're not going to be dealing with picky eating at 12 months old or 3 years old because we're addressing those issues now. So yeah, fantastic stuff that's available now. So it's exciting.
I love it. I mean, it's so needed, right? Like, parents are stressed out. Let's just like put it out there. Juggling so many demands, right, of modern parenting and having a baby and juggling, especially like a first time mom, like they're our special little crew, right? Because it's walking into territory where so many things are new. And so, um, and that can cause a lot of anxiety and a lot of the nervous system kind of dysregulation that we'll see. I love how you're saying like a timeline of the 12-year-old picky eater versus let's address this early before it gets into more habitual behavior patterns, because it's very similar in my PT clinic, where if we can address things early, like let's get that nervous system calm, then maybe we're not going to see that patient in their midlife having a lot more issues that have just layered onto each other. You know, the chronic pain and the autoimmune and all the things that come. So I think we're walking in parallel worlds and converging a lot too now
Yes. Mm-hmm.
on what's happening between the brain and the body, knowing that it is not just a feeding issue stemming from the mouth and the oral structure and function, but it's a whole body thing. It's a whole systems
Absolutely.
thing. And it's a baby and parenting thing. So your book it blew me away when you were like, "Oh yeah, I just happened to release this book in October." And I was like, "What?" So I really admire you, mother of 5 kids, running a business and doing all the things you're doing as a change maker and publishing this book that is like amazing. Once I started to dig into that, Rooted in Truth is the title. And I will intro this a little bit because I want our audience to know the title is really cool. The acronym for truth, standing for a method that you trademarked, right?
Correct. Correct.
The truth method, and that is teach, reclaim, understand, trust, and heal. Which I just like, that just melts my heart right there. Just knowing that you put so much meaning into the title. Your effort really came through to make this like a meaningful piece that you put into the world. So, talk to us about your book, Rooted in Truth.
So it's an opportunity for me to share my heart as a mom and feeding therapist, and again to normalize what a lot of these moms are experiencing. So there is social media is a beautiful thing, but there is a lot of noise out there, and there's a lot of it should look like this and these perfect, breastfeeding experiences, and these moms who think it's just fantastic with, when they see someone online have like an entire freezer stash of breast milk. And there's as many opportunities to celebrate the feeding journey, and then there's so many opportunities for moms to feel like they're not enough. And so
Yes.
that wounds people, and it wounds us for a long time, I think, further than we realize, when we feel like as a mom that we're failing as being able to provide milk in whatever format we want, for our babies. If maybe you're trying to bottle feed, you never wanted to breastfeed, but bottle feeding isn't going well and you feel like a failure, or you were trying to
Yeah.
breastfeed and for some reason your milk supply didn't come in, you feel like a failure. And so all of this comparison, we know it's not healthy, but it's something we can't run away from. And so the book was an opportunity for me to share my own experience with one of my children who was we had a rough road. And just having experienced that 20 years ago, and having had an opportunity to support moms, to be able to share the other side of that, and how, yeah, we're hoping to support you and your baby and to have the best feeding experience, but lots of like caring for mom and regulating her and rooting her to know that she's good, she has all the tools she needs, all the support she needs, and then for her to be able to trust her gut. Because if you, right from the beginning, if you feel like I can't even trust the way that I'm supposed to be feeding my infant, then you doubt. It's just this trickle effect as you're making the
Mhm.
next decisions for your child. And do we, and then where do we put our children for school, or do we homeschool? And you just doubt yourself. And I'm like, no, we need to break that cycle as soon as we possibly can, so that moms know that they are what their child needs and they can provide everything what their child needs. And so the book is a nice way to give very practical information. There's part of the title is spirit led, so trusting that there's a power bigger than us that's guiding us and providing for us, that we can rest in that. And so it really is like a whole body approach, looking at the wellness, the whole mom, the whole baby, the whole family. So it's very important that I feel like that is presented to families, that there's a safe place that them they can land.
I love that is so beautiful.
Thank
It's
you.
wonderful that, we say the word integrative so much. Like when we're talking about integrative in our healthcare circles, it's kind of like using multiple frameworks and lenses, right, to view one person or one case, let's say. But I love what you're doing here is integrative in the sense that it's not just the anatomical concerns, it's not just the physiological concerns, but it's also that really big picture that we all will confront as new parents or however many kids we have, being able to figure out, am I doing okay? Is my baby doing okay? And you're so right in mentioning and writing about this topic of doubt and how that can injure and wound us. I went through those similar phases as a new mom, a lot of anxiety. I was the mom waking up, could not stop looking at the monitor. I'm like, is she breathing? Is she breathing? Let me go check her. Is she breathing? And I remember one of my beloved practitioners in this interdisciplinary space. Her name is Jan Johnson. She's a nutritionist. She comes from functional medicine background. And she kept telling me, we were trying to get Ivy through some feeding things that might have been food allergy. We were trying to figure out, does this girl have allergies going on? Do we need to go gluten free, dairy free? Does mom need to go dairy free for this feeding? What's happening? All those questions that are gray areas.
Yeah.
And Jan, as the clinician hat, let's stay objective. Let's test this. Let's rule this out. We're looking at this. As the wisdom mother spirit hat, she kept telling me the same phrase: Kelly, trust yourself. And though it gives me chill bumps still, because those words, hearing them again and again from her, she was doing her due diligence as the scientist and
Sure.
figuring out our nutrition, but she was giving me so much support out of herself. It really was guided from a higher spirit, I know. Um, to be able to receive that from a person who I was putting my trust in, and seeking out of network advice, like we see a lot of moms and we're those providers too, saying the system's not working for me, the medical answers haven't been fitting us, what do we do? And to be able to hear things like that are, trust yourself, trust your mother's intuition. This process is teaching you something you need to learn, which is to look inward and to trust that intuitive part of ourselves that we're all born with. And so I do love that big picture spirit, mind, and heart that you're bringing through this. It's beautiful.
Well, thank you. Well, and you just brought something up about the doubt piece. There's so much. I think moms are learning to kind of, I'm gonna say, flex that muscle to trust their gut, but then they have maybe a well-meaning pediatrician who is less versed on this, who
Yes.
makes them doubt their gut, because of course, like, if my pediatrician, for example, is not seeing what I'm seeing or not validating what I'm experiencing, well, then I must be off. And so
Yes.
it's so important to have someone that can look at the whole picture and then point it back at the family. Say, okay, let's this is all of the clinical information we have. Does it make sense based on what you're seeing? Does that seem to resonate with what you're feeling? And helping them to kind of walk through this, whatever they're in your office or they're in my office, that we're such a collaborative effort with them as part of this team, like identifying what is actually going on and what's their goals in all of this. So
Absolutely. Patient-centered care. It's, I think of two big things that happen a lot in those early office visits with an infant. Like you were hitting on the dismissiveness, the sort of, mom comes in worried. She's talking about what she's seeing at home, what the parents are describing the symptoms, and maybe the pediatrician's going, it's okay. Things are okay. And the mom feels dismissed, like she's not hearing me. I'm still walking out of that visit worried as a mom because I got to keep this baby alive. And I'm not really sure I'm walking on solid ground right now. That happens. And then I think of the other really big deal that happens a lot, that fear can be just automatically ingrained. Let's think about those parents that are coming in with their infants not hitting the growth goals. And then they're being told, I don't know, it's not working. Like, we need to supplement. We need to do this. We need to do that. And it's this, they're being placed in kind of the medical model, and we're not hitting this number. And then mom comes away from that visit just, really lots of fear, lots of anxiety, that, like you said, the sense of failure comes up. And then not just like the sense of failure, because who has time to cope with the emotional part? You're just like, I got to figure out how to feed my baby and how to get things working like right now, pronto, because they feel a lot of distress over that. So the dismissed, the fear, it's big, and it ends up impacting the nervous system of that family in a big way. So let's talk about that in terms of regulating a nervous system, maybe in that arena of, going for those checkups, confronting the medical system in a way that maybe it's not intuitive care or patient-centered care. And then what do we do with the nervous system part of that to help facilitate the feeding pathway?
well, you hit on the mom side. So again, babies feed off of their moms. They share that regulation. That's why we use the word co-regulation. And so
Yeah.
that's why I felt like there was a huge part that was missing when I was just really lasering in on the infant and what was going on. There was a huge piece missing when we were just kind of letting the family hang out there and just dish them all the clinical information. And
Yeah.
so a lot of education and a lot of getting, again, like they're coming into the session. It's not just the mom just sitting in the corner and me treating them as if they don't know what's going on. Like, they're coming into this session and they're the ones that are leading it. And so when
Mhm.
they begin to feel empowered again, like, oh, I do know my baby. And oh, wow, you're listening to me, and like you're hearing what I'm saying, and you're hearing that, like, I really don't want to supplement with formula because I have this excessive amount of breast milk, and there is something else possibly going on, that it's not like, oh, it's just a dairy intolerance and I have to change to formula. Like, oh, there might be another reason why my baby's refluxy and crying all the time. And so when we do start educating them and validating what they're living, then their nervous system begins to calm down. And when, for example, when I'm saying, why don't we just start engaging your baby in a little bit more movement and putting your baby on their tummy for a supervised tummy time nap, then you can see the exhale where they're like, oh my goodness, like, I didn't want to tell you, but I've been putting my baby on their belly for their naps because that's the only time that they sleep. But my pediatrician is saying never put my baby on their backs. And so again, there's just this disconnect between following their gut and what the provider that they're entrusting their baby with is giving them different information. So those are just very small examples of how just collaborating with the family and helping them understand that what they're doing is what's best for their child, we start to see mom, dad, the whole family, there's much more peace in the home, and then the baby feeds off of that. And then we're seeing, oh wow, like feedings are just naturally starting to be less of a fit for my child, and they're smoother, they're not taking as long, the baby's not as fitful, and everything kind of just begins to regulate. And so it is like we can look at the baby specifically, but we're not treating from a holistic lens if we're not looking at all parts.
Absolutely agreed. I love that you spoke about the validation. Is it
Mm-hmm.
validation to any of our patients? Because they're walking through difficult times, right? Like we are not
Absolutely.
in our fields, we're not seeing anybody who has it on easy street.
No.
We're seeing people who are really trying and struggling hard. And so I feel like validation is like a medicine.
100% agree.
Yeah.
Because I mean, they don't want if a mother is having trouble, the only thing she wants is to just be at home in her postpartum days, weeks. She just wants to be home. Like, she doesn't want to be in my office. And, like, respecting that, I know it took a leap of faith for her to maybe go against what someone told her, like, oh, why are you doing that feeding therapy thing? Like, what is that going to do for your baby? Or again, just the time, the energy, the money, like it's like there's so much respect for a person who's willing to take that step in, like, oftentimes just out into the water. They're like, I don't know what this is. I heard like my friend or my family say this was helpful. And so like just acknowledging that you are so brave and this is amazing that you are willing to do this for your child, because they don't oftentimes understand anything that we're doing at the very beginning. And so immediately, I agree, validation is medicine, because once they're like, oh my goodness, you were speaking the same language again, like, okay, like I can, like, healing can start at that point.
Love that. I think you hit on two things major I want to circle back to. One is when you mentioned the tummy time as a practical, let's, you know, it kind of, what's the word? It's asking the parent to change their expectations, right? From what they have learned. Oh, don't place your baby to sleep on their tummy, back to bed, all that stuff, which we could get into that. That's another podcast episode, I feel like.
Absolutely. Yeah.
Um, but when you mentioned that, it's again trusting that we're going to attempt this and see what happens. And what do you see happen? I'm calling on our Lori Hendrickson classes for this too, because she would do this, flip the script and do something mobility wise and different. And we know we can get some good sensory regulation out of that diaphragm and abdomen where vagus nerve is. So what do you see in that? Like, walk us through where you're in that family space and they're like doing tummy time to put that baby to nap.
So, I mean, there's so many benefits. We know that movement is one way to calm baby. We also know just having baby on their tummy, nervous system, and their gastrointestinal system are going to be in the most calm place that we can possibly put the baby. And that's very difficult for mamas and dads sometimes who have refluxy babies to wrap their head around, because like, oh, I'm holding my baby 30 minutes after we feed before we put them in tummy time. And again, that's another leap of faith where I'm like, okay, I want you to just feed your baby, burp them, and I want you to go into tummy time. And I know when they do that, that oftentimes is a stretch for them. But when they start to see that Yes, my baby maybe spit up a tiny bit. And I'm like, that's air that was possibly trapped that we got out of their system. So don't freak out about the little spit up. Don't deter the next tummy time exposure because of that. Um, and so, because the baby will always be less refluxy, just the way anatomy is, the baby's always going to be less refluxy on their tummy than on their back. And when we get more pressure on their abdomen, supporting a calmer GI system, ventral weight bearing, that's a therapy term, but being on their tummy is so supportive for the nervous system. Moms and dads are just in awe just seeing a baby being handled, and like, oh, I can move my baby that much. Like, oh, look how much gas they're passing. Oh my goodness, I can't believe they pooped. And so when they just see that things start moving and baby starts feeling better, they're much more motivated to put their baby on their tummy. And I love seeing like the follow-up visit when the mom looks more rested and she's like, oh my goodness, we're getting naps in the day and we're having better nights because the baby's getting better sleep during the day and they're not as gassy and refluxy. And so that's pouring over to better regulation and better quality of sleep at night. So it's so exciting. It is so critical that we get our babies out of swaddles and get them on flat surfaces and get them rolling and onto their tummies. There's nothing more that we can do for our baby. That's what I tell moms. I'm like, if you're overwhelmed with the things I'm asking you to do, then after every diaper change, roll your baby to their tummy and let them engage in a little bit of time on their tummy. It's going to pay off in big ways.
Absolutely. That's golden because what you just shared, that tip of after every diaper change, let's do a little bit of this. And then the mom's like, I can do that.
Absolutely.
And you're so right. It's that variability that also matters a lot to that growing nervous system and musculoskeletal system. The swaddle, I'm not going to lie. I swaddled my little baby up like a burrito and oh my
Right.
God, she was so
Yeah.
comfortable. So, and I'm the PT brain too. I probably did a little bit too much swaddle sometimes because like I needed to nap or have,
Yeah,
the quiet.
absolutely.
But now what we know is 2026, and we both recently trained with the craniosacral course that Lori Hendrickson brought. And I just love her. I mean, isn't she like a spark of life?
She is.
Um, and so in that, I loved how she was talking to providers across disciplines, OT, PT, doulas, lactation, chiro, everybody. And we were discussing get these babies out of those devices, get them out of that carrier, get them out of that, all the different brand names. I don't know what's
Mm-hmm.
the what's the one you
Yeah,
see right
right.
now, whatever
There's
they
so
are.
many. Yeah, I can't
They're
keep up.
limiting, yes, and they are
Yes.
limiting growth and development. They're not only limiting the development of strength and coordination for those neck and postural muscles that go along the back, because we need our babies curiously exploring their world and looking up during tummy time. And let me see if I can see that thing over there. Where's my mommy? Where's my daddy? Developing those muscles comes from being out of those limiting positioners and swaddles and carriers. And we're not saying go to zero, but there's a middle
Absolutely.
ground.
Yes.
I feel like socially, our busy, busy, busy modern lives has, conveniently packed our babies into these little carrier devices everywhere. So that means they're not doing enough tummy time in general across the population. And we see that in our schools. We see that in our
Right.
behavioral changes later on. So the ability for that nervous system to regulate is a very physical and environmental driven thing. And if they have this little limited window in physical capacity, it is not serving them. So we want to take that, we want to move and squish and play with that baby as much as possible in different orientations, do the
Absolutely.
Superman airplane, do all those little diaper change techniques. It's so fun to make it practical. And when we're
Absolutely.
playing and having fun, our nervous systems are naturally regulating. When we're in the fun zone, we are not in the anxiety zone in our brains. So our bodies are co-regulating so much easier when we're just playing with their little squishy bodies too.
Absolutely. Yeah. And that's one of the ways that I'm able to support regulation for mom and baby when they're doing tummy time. We're going very, very step by step. Michelle Emanuel, occupational therapist, her tummy time course, she does an amazing job of really pulling in the importance of social regulation with tummy time, and how when exactly what you just said, when mom is having fun or dad's having fun, then the co-regulation can happen. Baby can regulate, because let's face it, if they've been swaddled or been in different containers or devices, they have, maybe tummy time is going to be a little challenging to start off with. But again, validating to the parent, you're helping their regulation because you're going to stay very socially connected with them, and that's going to be powerful to kind of get your baby over those little periods of time when they're learning a new skill that might be a little uneasy for them.
Yes, I'm glad you brought that up too, because the real world bumps in the road, right? There's a lot of those leaps. We used to call them leaps. Do we still call them that?
I hear moms using the words leap still. Yes.
Yeah, and it's like the my little window into it is where that baby's the whole brain and body is doing a super lot of processing.
Absolutely.
And in those learning zones, it might feel really rough. Maybe sleep is a regression. And it's like the dreaded, like the 4 month sleep regression, like as if baby's going to know 4 months is like right there and just
Right.
start crying all through the night. But, we have these patterns that will hit those bumps. So, do you have any, like, give us a few tips from Ashley to family of when we're hitting those bumps and things are like we were in a good path, we were doing great, and then this started happening, and it feels like everything falls in at once and we feel like we're losing progress. But what can we do to get through that?
Well, when I had this conversation with a mom yesterday, she was like, I feel like things were progressing and then we hit a bump in the road. And
Mm-hmm.
oftentimes that's when we start to doubt ourselves again, that what we were doing, oh, maybe that wasn't what my baby needed. And so we stop getting consistent with the things that were actually helping your baby. And again,
Yes.
that's one of the things that we're talking with mom about, like, just when you get into a rhythm, there's going to be another maturational growth. There's going to be something that's going to shift. Your baby's going to shift in their naps, or they're going to need more bigger bottle feeds or longer breastfeeds. There's something that's going to shift, and then your routine is going to get out of whack of what it is right now. And so again, the things that are the cornerstone of what we're helping, as far as maybe the suck work that they were doing and the amount of movement that they were doing, and just mom starting to doubt herself and her baby feeling that anxiety, makes it can be the triggers that kind of will see things not continue to progress. So I just tell the parent to, again, just kind of hold steady and continue doing those things that have been helping their baby. And again, the little ones that I'm seeing that are coming in my world, yeah, their suck coordination may be off. And so that's number one way of calming the nervous system. And so if there's been lots of compensation, so like around that 4 month, that suck reflex is really, it's shifting and it's volitional. And a lot of times we're seeing, oh, we can't use those compensations anymore. And so we're having to support mom and dad being able to get their baby to regulate in a slightly different way. And just again, it's not like it's never going to come back to this place of homeostasis again. It's just be consistent with what was working and don't lose faith that you know what your baby needs. So continue all the movement, continue all of the social connection. It's not like, oh, baby doesn't want to play with me anymore. No, like, continue doing those things. even though you might be going through a little rough patch. Just as baby's brain is absorbing something new, and developmentally it's a lot going on, and so they might be a little bit more agitated than they were last week. But take that as a win, like they're becoming more aware of their environment and something is happening in their little brain. So see that as like a positive and don't fret over that.
Absolutely. Don't we all need to hear that sometimes when there's bumps? It really helps to kind of do that supportive hand holding care that's positioning not just the baby's feeding or dysfunction or however we would label that diagnostic window, but really, again, at the end of the day, it comes back to feeding as a nervous system experience, as a relational experience within that family. Yeah.
For sure.
Love the work you are doing. I want to provide for our audience a few ways to get in touch with you because I know there might be more questions. So, do you do in home and in clinic?
So yes, so I have a brick and mortar company. I also in Thibodeau. We'll go to Homa as well, and yes, I do. On case by case, I'll do some in home. I mean, again, like that's the joy of working with moms where they are,
Mhm.
and so, yes, there's lots of opportunities. So you can visit our website, sensorysolutionsTherapy.com. I'm on Instagram, Sensory Solutions, on Facebook. I just started a new Instagram page, the Faith OT, the .faith.ot. And just again, for the parent who might want more faith based aspects incorporated into their care. I know it's so important for some people, and so you can find me there. And so, yes, lots of opportunities to connect with me.
Very exciting. I love that you keep branching out and finding your passion,
Yes.
the.faith.ot, right?
Yes.
I feel like when providers are creating, that is like the good, juicy stuff, right? Like when we show up at our airway interdisciplinary meetings, we are not coming with answers in these spaces. We are coming with curiosity and
Yes.
what do you know? What can I learn? And we're all kind of really refining like what it is that we want to grow and learn into and following our passion. So to me, that you're doing new things all the time is just a signal that, you're really in it and you're doing this work that you're called to. So I appreciate that.
Well, we know
Um,
it's a mission for sure. It's for
it
sure.
is a mission, it is a life mission, and it's always changing, it's always evolving. So I want to end with a question. I love to ask my guests something on a personal note too, because, we're all human and we can all relate to each other. And I want to ask, what is it that you feel is a tool that you go towards for regulation? What's some of your stuff that you use when Ashley's had a stressful day running a business and running a family everywhere?
Yes. So, again, I'm a faith-based person, and so I have in my day my little my prayer time in the morning, and that I wake up earlier than I would really want to wake up, and I get to spend some time with the Lord, and that kind of sets the rhythm. I also feel like when my head wants to go in a thousand directions, I've really disciplined myself and I don't do the doom scroll or listen to something that's not going to kind of bring life back to me. And so I love listening to my Christian music, and I really do. I lean heavily on my faith. I also think movement in general is really good. So any opportunities to go outside. I don't like to wear sunglasses because I want to take advantage of all the vitamin D I can get from the sun. And so when I'm driving, maybe between clients, I put the window down, get some fresh air, and And then when I am lucky enough that I can be outside maybe for a little bit of time, love taking my shoes off, putting my feet in the grass, getting some grounding. And so, again, nothing fancy, the little ways. Again, you know that if we try to make it something monumentum, it's going to be overwhelming and we're not going to do it. So I just try to do the little things that are going to, I can be consistent with.
I love that. And that's living through example, right? To the people that we show up every day. We wake up in the morning and we get grounded so we can go out and help others who also need that grounding. So pat on the back for you finding
Thank you.
those ways, to be able to
Thank you.
work it into your busy routine. The consistency is amazing over time. And then we all kind of need, I feel like we need to kind of change it up. We're both in midlife, right? So we're finding like, oh, well, I kind of need to like enhance this part of my day a little bit more, or maybe take this off my plate. We're all navigating these things together. So
Absolutely.
I love that you brought all of this insight and practical solutions for us all. Thank you so much, Ashley. And let's do it
Absolutely.
again. We're going to be
Love it.
learning some new information soon. So
Absolutely.
let's do this
Yes.
again on either your place or my place.
Would love it. Would love it. Thank you so
Thank
much.
you.
This is wonderful.
And everybody can find Ashley's info on all the places she listed. She's everywhere online. Go check out her book, Rooted in Truth. And we'll see you next time for the next episode. Thanks, Ashley.
Thank you.
Bye bye.
Bye.